live. I hope you must have just finished your clinic and are on Insta Live and YouTube Live. So let us start today's session. Let us first understand some of the questions which were asked last time, and owing to the shortage of time, I could not answer. There were some questions where the doctors had asked that when to take sit. There was a case where the patient was just telling that whenever he sits, the complaint starts. Whenever he walks, he feels better. In that case, remember one thing. Yeah, welcome, Dr. Santosh, Dr. Ruhi. Well, remember one thing: is that symptom related to a particular part? For example, if the patient says that I cannot sit, so it is related to a specific symptom, like only backache is not better by sitting, or the patient sits, that's why sciatica increases. If it's a local symptom, then you have to take that local symptom. If it's a generalized symptom that the patient says I just cannot sit, whether it is sciatic, whether it is headache, whether everything, so it's a constitutional symptom then. So it is very important to understand and differentiate what to take. For example, if you open the chapter of generalities and just see the rubric sitting aggravates, so you can have remedies like phosphorus or lycopodium or rustox, XYZ, a lot of remedies. I can think of dulcamara, euphrasia, pulsatilla. In the same way, if you see the same chapter, sitting aggravates and then sitting ameliorates. Now, there are other remedy also that the patient wants to sit. So make sure whether the symptom is general or it's particular. For example, if you say sitting ameliorates all the complaints, then you have remedies like colchicum, we have digitalis, we have nux vomica, we have bryonia. So it's very important to understand whether it's a constitutional state or that symptom of the local part. Okay, this was basically a question which a lot of people have asked me, because I think there were a lot of cases of arthritis or sciatica or neuralgia. So differentiate whether it's a patient symptom or the local symptom of particular part. Welcome, Vaibhav. Dr. Arora, do you have any used iodum treatment? If you, then, do you have ever used iodum? If yes, then please share experience. Why not? See, if you understand iodum, see, it's basically one of the very polycrust remedies, and if you go to iodum, there are so many symptoms. But if you have asked iodum, and I think I would have I think never taught iodum in YouTube live. So whatever iodum I have seen in my practice, I'll just share some of that. Remember, my dear friend, what's your name? The best videos. If I can get your name, it will be fine. Dr. Babel, welcome. Nishant, welcome. Iodum. You have to see one thing in iodum. There are a lot of cases of anxiety, a lot of cases of depression in this world, because see, in this now psychosyphilitic phase has come where there's a lot of fear, a lot of anxiety, a lot of this. If you want to prescribe iodum, the most important symptom of iodum that you have to remember is exercise ameliorates. Patient says that whenever I feel anxious, I go to the gym, I feel relaxed. I just go for a walk, I feel relaxed. This is a very, very important entry point of iodum, my dear friend. Exercise, or you can say anxiety is better by exercise. One thing. Iodum is there, of course, sulfur is there, I think graphitis is also there, but iodum is a very, very important remedy in this case. For example, iodum says whenever he eats, whenever he starts eating, the anxiety is better. Again, a very, very important symptom of iodum, anxiety is better by eating. If you say exercise ameliorates, there are three remedies where the patient says that exercise ameliorates, but iodum is a very, very important remedy in this symptom. Exercise ameliorates, you can take a very, very interesting remedy, chelidonium and tarantula. So both the cases iodum is there. Next, if iodum is better by eating, then mentally the patient is aggravated by fasting. Remember this and write down in your Mathematica. Iodum patient anxiety is when fasting. So patient says, whenever I eat, no, I feel better. Think about iodum. This is a very, very important symptom that I have seen in many of cases of iodum. In fact, sometimes I would say that whenever I am prescribing iodum, I do take this symptom into account, whether this symptom is present in that patient or not. And most of the cases I see that this symptom is present in the case. Best videos, if I can get your name, that I would be sharing my experience with your name. Next, if you remember iodine, of course, it is said that iodine is a very hot remedy in XYZ. It is so emulated by eating that if you open that dream of iodine, the iodine patient is better by eating, or he dreams of eating. Such a very, very important symptom of iodine. The patient has dreams of eating. You know, this is the importance of iodine. Only 3-4 cases which I can see. And it is written in iodine. Very, very important. Physical exertion ameliorates. There are the remedies where the patient says the mental exertion ameliorates, physical exertion ameliorates. In iodine, physical exertion ameliorates. So an iodine patient, he works too much. He walks, he does exercise, he does gymming. He sits in one place and the disease starts. So physical exertion ameliorates. Iodine is a very, very important remedy. Then the patient is irritable, then there is mania, then there is sadness, then there is weeping. Lot of symptoms are there. But these symptoms are very, very important if you enter a case of iodine. In fact, in iodine it is written, sits aversion to. He cannot sit. That is iodine and that is lacacy. So I hope you understood, got some idea about iodine. And if you don't have any questions, I can still prolong in that. Yes, Dr. Babel, Dr. Chauhan, welcome. One more doctor with no name, so I have. गुड आफ्टरनून सर जी, या मिश्रा जी, गुड आफ्टरनून. समझा आपको, मतलब ये आयोडम है. एंड आयोडम, मेरे पास एक केस था, देयर वाज लॉट ऑफ टोरपोर in Addison's disease. So whenever there's a lot of torpor, you must think of iodine, especially it is written in Addison's disease. But in torpor, in generalized, you can say you can use iodine. Or if you give me some thumbs up, I can go ahead, torpor also, that is physical inactivity, letharginess, that is also iodine. So if you have understood, I think we can go further. No thumbs up and no heart, so how do we understand? So do I continue iodine mind, or I have to shift somewhere to other questions? Anybody? Be fast. As such, people said half an hour is very less, but if you answer the questions fast, I'll be very fast. Good afternoon, Dr. Vishaka. So let us go further. Iodine, do we have others? Do you want some other symptoms, or I should go forward with other questions? Okay. So I think it's through. Next question, which was asked in my OPD, and my students asked me on WhatsApp also. Sitting we have done. One symptom is very important whenever you are prescribing. In fact, if you're taking a very, very big rubric, so people tell me that whenever we take a big rubric like anxiety or absent-mindedness or absorbed, there are a lot of remedies. Of course, see, whenever you are treating a patient, you have to first understand the generalized state, the summarized state of the patient. How is the patient basically? That cannot change. And then gradually, with the help of Mater Medica, what I do, I enter the case, you ask some questions, so that you start eliminating lot of other remedies, Sorry, that is very important. So it is not only that repeat. Then of course your last, whatever I do, last entry point is definitely Mater Medica. So this is how basically I enter the case. Again, one question was asked because I had put a rubric in repertory, admonition. Now you see, admonition is not that exactly opposite to domination. See, Brownia, thirsty, and see, if you open the Mater Medica and repertory, there are some rubrics where anti is there. Matlab, in one part it is said thirstless, other parts it is said thirstless and thirsty, because there is long intervals between two thirsts. I drink one glass of water now, and maybe I drink one glass of water after 3-4 hours. So if you understand that part, in some part it is written thirstless. That's why it is written thirstless, because thirst for a large quantity of water at long intervals. So it is sometimes split in some Mater Medica and also, but normally we take thirsty in Brownia, because in most of the complaints Brownia is thirsty. Only in some complaints which I have seen, Brownia becomes thirstless. That's why it is written, and both the forms can be taken in case of this rubric. And many medicines, that's why I was telling you, that's repertory. And see, there are a lot of repertory, keep adding on the additions, that every year some addition comes back. And so whatever the author finds, whatever the author sees in his practice, he keeps adding on. That's why I told you, I think long before in my YouTube, that after maybe 10 years, you will have one rubric covering most of the remedies, that for example, abrupt, or a simple rubric called precocity. Fartak has 3 remedies. complete remedy has 19 remedies, and if the what you call addition keeps on increasing, the remedy will also keep on increasing, and there will be a lot of confusion which to take, what to take. So whatever repertory or verse you are well versed with, whatever you're using, and you're getting good results, I would say follow that repertory, because if you keep upgrading, sometimes one rubric covers most of the remedies. So when you repertorize on common symptoms, there are so many remedies covering all the rubrics, then it becomes very difficult to individualize the case. So it depends on which repertory you're using and which edition you're using. And in new edition, there are a lot of editions of a lot of remedies. That's why you see a lot of rubrics, a lot of remedies in one rubric, which had only 3-4, now it has 30-40 remedies. So it depends upon your thinking and all. Dazzling मेडिको वेलकम, डॉक्टर विशाखा वेलकम, मिश्रा जी. सो आप लोग को सब आई होप समझ रहा है, एंड आपको समझ रहा है तो जरा एक ये दे दीजिए व्हाट्सअप. एलिमेंट्स फ्रॉम थम्स अप दे दीजिए. एलिमेंट्स फ्रॉम एडमोनेशन. सी एडमोनेशन मतलब काइंडली एडवाइस. लम्बैगो, एग्रेवेशन, सेटिंग, नफाइलम, मैककार, राइट, फॉल. तो आप मुझसे दवाई पूछ रहे हैं एग्रेवेशन बाय सिटिंग. सी अभी हमने किया मतलब एग्रेवेशन बाय सिटिंग. तो जब भी आपको, मैं वही इस बार कह रहा था डॉक्टर मिश्रा जी कि आप कब लेंगे सिटिंग और कब नहीं लेंगे सिटिंग. तो अभी आप देखिए, जब भी आपके पास पेशेंट आता है एंड द पेशेंट से सिटिंग से हमको एग्रेवेशन है, आप सोच सकते हैं कॉस्टिकम, आप सोच सकते हैं पल्सेटिल, आप सोच सकते हैं रस्टॉक्स, सल्फर भी सोच सकते हैं. ये बहुत इंपॉर्टेंट सिम्टम है. और कभी कभी पेशेंट बोलता है कि मैं बैठ सकता हूँ, लेकिन डॉक्टर साहब क्या है, मैं बहुत ज़्यादा नहीं बैठ सकता. आपकी ओपीडी में मैं आता हूँ, मैं 10 मिनट बैठता हूँ, लेकिन क्या आपके यहाँ बहुत रश रहता है ना, मैं ज़्यादा बैठ नहीं सकता. तो क्या आप मुझे तुरंत दवाई दे देंगे 10 मिनट के अंदर? मैं बहुत नहीं बैठ सकता. ये पेशेंट बोलता है, और बस ये जो बोलता है उसमें रेमेडी निकालना है आपको, और वो रेमेडी बन जाती है पल्सेटिला, रस्टॉक्स. ये बहुत इंपॉर्टेंट रेमेडी है. ओके, तो ये जब बहुत लंबे टाइम तक बैठते, प्रोलॉन्ग बैठते, तो पल्सेटिला, रस्टॉक्स और नेट्रमोर भी बहुत अच्छी रेमेडी है. तो ये फिर अच्छा लगता है. बट फिर क्या बोलती है वाइफ, आके बोलती है डॉक्टर साहब जब उठ के बैठते हैं ना तो उसको थोड़ा तकलीफ होता है. फिर मैं क्या थोड़ा बैक उनका मल देती हूँ तो उनको अच्छा लगता है. तो फट से हमारे पास दूसरा रूब्रिक आ गया कि रबिंग एमलेट्स. उसके बाद सोचिए फॉस्फरस, उसमें सोचिए अगेन थूजा, एंड उसमें सोच सकते हैं आप काली नाइट्रिकम. तो जब भी ये सब सिम्टम जब पेशेंट बोलता है ना, तो एकदम बहुत कीनली ऑब्जर्व करिए पेशेंट क्या बोलना चाह रहा है. एक्चुअली पेशेंट आपको सब रेमेडी बताना चाह रहा और मोडेलिटी बताना चाहिए. इसमें आपको पूछने की जरूरत नहीं है, पेशेंट बोल रहा है उसमें दवा दे दीजिए. ओके, धन्यवाद मिश्रा जी. आपको समझ गया तो एक थम्स अप दिया कीजिए, तो मुझे पता पड़ता है कि समझ गया. अदरवाइज मैं और आपको एक्सप्लेन कर सकता हूँ. डॉक्टर कादिर, आई कैनॉट प्रोनाउंस द नेम. या वेलकम. सो ये 2 चीज़ होगी. अब तीसरा चीज़ एडमोनेशन पे मैं जाने वाला था. अगर एडमोनेशन मतलब काइंडली एडवाइस. कभी कभी क्या होता है, अगर आपने मेरा रेपिटरी का वो वीडियो देखा है, अरे डॉक्टर साहब मेरे फादर बहुत अच्छे हैं, पर मेरे को बोलते देखो बेटा पढ़ाई कर लो, आप 4 से 5 पढ़ाई करो, फिर 6 से 7 आप रेस्ट ले सकते, फिर ये कर सकते, वो कर सकते. पूरा मुझे टाइम टेबल बना दिया. बोले प्यार से बोलते, लेकिन मुझे पसंद नहीं आ रहा. आई डोंट लाइक माई फादर गिविंग एडवाइस. भले ही गिव्स काइंडली एडवाइस, आई डोंट लाइक इट. दैट इज एडमोनेशन, दैट इज काइंडली एडवाइस पसंद नहीं है. अभी there are 2 things in that. One is children and one is adults. Another child is about 20-25 years of age, and still the father is telling do this, do that, go there, go. If he's a medico, go and join that doctor, go and join that doctor. I had a assistant where the assistant was very unhappy, and the doctor said you go you join Dr. Chimthanona, then go do some night duty, then in the morning do this, do that. He says, sir, I also have sometimes to think what I want to think, but my father does not allow me to think. Though he tells me very kindly, but still I don't like it. That is element from emotion. Kindly advise. We have in children we have carcinogen, we have meteorinum. Normal you can take remedies like platina, like stramonium, like belladonna, like nux vomica. So this is admonition. It is something very different from domination. In domination, it is you have to do this only and you have to do this only. You can't do anything else, and the patient has to do that. It's like a bonsai plant, when the plant grows, cut that plant, and that is domination. So you have to be very clear in which rubrics you are taking, either admonition or domination. Okay. Eye tears, mild plus redness of inner corner of the left eye in 97-year-old female. Wow. Pulsatilla, Rustox, Euphrasia, Natrum, Mure, Argentum, Nitricum brings no real improvement. Do you have any idea? Fantastic. And let me First, congratulate the patient, 97, 97 years patient, and still only symptoms of only redness of eye. Well done. And the patient has maintained supposedly very, what you call, good lifestyle and hygiene. So it is a very good thing. But see, whenever you have these type of complaints where it is old age and the patient has, there are some questions on the WhatsApp also. If possible, just send me on the before, so that I can always answer. Okay, so I have something on my WhatsApp also. I'm just seeing the question. So yeah, I was telling a 97-year-old lady, redness of the eye, especially in this, Dr. Babel, do two or three things are very, very important. First, the modality. When it is more in the morning, in the evening, or in the night. First thing is that. Okay, you've added. No. And second thing, it is better by cold, it is better by warm. That is also important. And now inner canthi, most of the remedies you have taken care of. Two or three remedies which are very, very important, which you have not listed in your, I think. First, you must think about, in these type of cases, the first remedy you think about is sulfur. Second, you must think about is magnesium carb. And third, you must think about calcareous sulf. Your case lies in between three remedies. Okay, Aurora, thank you. Dr. Porvayu, tuberculum and gland affection, light also. Yeah, in this age normally you can have photophobia, so these three remedies are important. Tuberculum and gland affection, you experience the patient has burning pain in the submandibular gland. After 3 years, sulfur, calcarea didn't chili, woman can tuberculum help. Whenever you're taking a case of affection of gland, see, tuberculum, see, you can I cannot tell you that this remedy will not work and that will work. It depends on case to case. No, if it is a case of tuberculum, then it will work. Definitely tuberculum would work. But if it is a case of medorinum, or it is a case of lapis alba, or it is a case of lappa, or it is a case of phytolacca, or it is a case of conium, depend upon the symptom similarity and depends upon the symptoms of the patient which he has at the local part. So these are the remedy that you should think about rather than tuberculum, unless you want to give an intercurrent remedy and the patient maybe is of tuberculosis or history of TB in the past or history of recurrent cough and cold in the past. But do think about medorinum also, do think about these remedies which I have told you, because these are better. If the glands have burning, then you must think about phytolacca, you must think about calcarea ars, and you must think about one very interesting remedy, sister scan. No real modalities. Okay, so these are the sir mind methods. So क्योर होता है? नहीं, होम्योपैथी में सी इट इज़ नॉट इम्पॉर्टेंट कि माइंड मेथड है कि बॉडी का मेथड है कि क्या मेथड है. हैनीमैनियन मेथड फॉलो कीजिए. पेशेंट आता है, केस टेकिंग करिए, उसके माइजमेटिक शेड्यूल देखिए, कौन से माइजम में आपके पास आया, सोरम में आया, साइकोसिस में, सिफिलिस में, वो देखिए, उस पर दवा दीजिए, डिफ्रेंशिएट कीजिए, मैथमेटिक के सब आपको रेमेडी मिल जाएंगी. अभी माइंड मेथड है तो भी रिजल्ट्स आएंगे, बॉडी के मेथड है तो रिजल्ट आएंगे. आपको जो सूट करता है, आपको जो समझ में आ रहा है पेशेंट क्या बोल रहा है, फर्स्ट ऑफ ऑल केस टेकिंग अच्छा कीजिए. एक बार अच्छा केस टेकिंग आ गया, अच्छे रूब्रिक्स आ गए, माइजम को मैच कीजिए और आपको बस रेमेडी आ जाएंगे. ओके, सो रिजल्ट तो सब जगह आते हैं. डॉक्टर बतूल कुरे, ओके, वेलकम. डॉक्टर शंकर वेलकम. डॉक्टर फरमान वेलकम. सो ये सब होता है. आया डॉक्टर बाबल, आई होप यू गॉट सम आंसर सर. माइंड मेथड ये सब में रिजल्ट आता है. होम्योपैथी में देयर इज नो प्रॉब्लम. होम्योपैथी ऐसी पैथी है कि आप किसी को भी वो डिसअपॉइंट नहीं करती है. आप मेथड को भी यूज़ कीजिए, बट वट एवर आई थिंक दैट यू फॉलो द मास्टर. हैनीमैन इज देयर, ही हैज़ रिटन एवरीथिंग इन हिज बुक्स. इफ यू कीप रीडिंग ऑर्गन, इफ यू कीप रीडिंग मैथमेटिक एवरी डे, योर concepts will also be better. And see, unless you try to interpret the patient's language into the form of repertory or mathematica, you are not going to get the results. No, so it is all mind. It is all mind. Just I told you one example. Patient comes and says in your clinic that, Doctor Sahab, I cannot sit more than 10 minutes. Please take me early. So aggravation by prolonged sitting. That is the remedy. Natriuretic is there, Rustox is there, as we discussed. So whatever the patient tells you, it is your third eye which you have to open and understand what to interpret and what symptom to take for prescription. Because when you take a very lengthy case, maybe of 1.5 or 2 hours, you get a lot of symptoms to repertorize. That is an art, which symptom you take for repertorization, and that depends on which miasmatic schedule the patient is coming from. That miasmatic symptom, if you take for prescription, you get the results. Okay. Yeah, so Dr. Babel, don't try. I think your case should be within sulfur. So give a dose of sulfur. Can we give any medicine for cancer patient bad effects of chemotherapy? Yes, a very, very interesting question, and as I have grown in my practice, I've got a lot of cancer patients, a lot of cancer patients who have come, and first it was our conception that, okay, whatever the patients come, give Naxomic and antidote that patient. But of late I have seen it does not happen. And we have different medicines also, which are potentized, allopathy medicine potentized. For example, if you have got a case of cancer of a uterus or ovary, it is removed in a female at a young age or at the age of menopause. There are so many remedies, because that's a hormonal imbalance. Then you must think of remedies like progesterone. You can think of remedies like estrogen. You can think about like remedies like testosterone. Of course, if the patient has done chemotherapy with other remedies, like we have cobalt 60, we have 5-fluorosilol, we have methotrexate, and you must be surprised that we have these remedies in potentized form also. We have remedies cobalt, we have remedies methotrexate, we have remedies 5-fluorosilol. These are the remedies which are potentized, and if you give these remedies, to the patient, it really works wonderfully. Radium brome, it works wonderfully. And this is basically, you can say, tautopathy, which Hahnemann also told something, tautopathy. So you can use these type of remedies. They are available in the market. Use 30-200 potency, and that has also given me very good results. Apart from the common remedies, of course, I basically, whatever I preach is more of common remedies. But if that fails, then these are also areas where you can think about and use these remedies in your practice. Okay, I hope, Dr. Wasim, you could get some inputs. इंडिया यू कैन यूज दिस इंटेस्टाइनल लोड, यू कैन यूज दिस रेमेडीज. सर, लाइपोमा एंड ट्यूमर क्योर होता है आजकल बहुत ज़्यादा क्यों बढ़ रहे हैं? सी, अभी आप देखेंगे डॉक्टर गणेश जी कि लाइपोमा तो पहले भी थे, बट अभी आप देखेंगे बहुत सारे, अगर आप डॉक्टर्स को पूछेंगे कि पोस्ट कोविड, आफ्टर पोस्ट कोविड वैक्सीनेशन तेरा, ऐसी क्रॉनिक बीमारी बहुत ज़्यादा बढ़ रही है. जैसे अवास्कुलर नेक्रोसिस ऑफ फीमर बहुत ज़्यादा है, कोलेस्ट्रॉल के केसेस बहुत ज़्यादा है, सीडी के केसेस बहुत ज़्यादा है, सीकेडी के केसेस बहुत ज़्यादा है, थायराइड के केसेस बहुत ज़्यादा है, और लाइपोमा के केस भी बहुत ज़्यादा है. अक्यूमुलेशन, बहुत साइकोसिस बढ़ रहा है ना. हम 8 घंटे के, हम 15 घंटे काम कर रहे हैं, हम हर चीज़ छुपा के करते हैं, बहुत फसाड है हमारे आगे, हम जो है वो दिखते नहीं, और जो नहीं हम कोशिश करते हैं हम दिखना चाहिए. तो लॉट ऑफ साइकोटिक डिजीज हैव कम. और जो लाइपोमा के केस है, मेरे पास भी बहुत सारा लाइपोमा के केस है, और मैं आपको ये बहुत आराम से बता देना चाहता हूँ ट्रांसपेरेंसी से कि मेरे पास भी केसेस है. बहुत किसी किसी केस में अच्छे रिजल्ट है, किसी किसी केस में कुछ रिजल्ट ही नहीं है. तो मैं भी बहुत कोशिश करता हूँ इसको रेपेटराइज करने के लिए. बट लाइपोमा में कुछ दवाई, डॉक्टर गणेश, बहुत इंपॉर्टेंट है, आपको सोचना पड़ेगा. थियोसिनामिनियम, लप्पा, लेपिस एल्बा, ग्रेफाइटिस, ये बहुत अच्छी रेमेडीज है. अगर आपके सिम्टम और कॉन्स्टिट्यूशन मैच करता है तो आपको उसको देना चाहिए. ओके, क्लियरली बताना चाहता हूँ मैं. One more patient has joined, one doctor has joined, but his name is something very Z and I. So, welcome. I hope you understood, Dr. Babel, and do share some results, But because these are cases where 97-year-old female, and just a psoriatic symptom of redness of eye, wonderfully. Okay, the patient has taken care of herself very nicely. I hope Dr. Ganesh ji आपको समझा, and अगर समझा तो थोड़ा thumbs up दीजिए, so I think we can again move to some other questions in line. Okay, if there are some questions scrolled up, if your questions have been scrolled up, do write it again, otherwise I'll again start and on matter medica. So whatever, if not, then pro healthy family care, yeah, welcome. Now going back to iodum, if you have no question. Iodum has one symptom, very important symptom, desires to kill. There's a sudden impulse, desire to kill, sudden impulse. It is said in a mater medica, almost irresistible, especially in women. Of course in men also you can take that. Which mother tincture for gallstone? Gallstone we have done in YouTube and Insta few months back, but whenever you want to prescribe for gallstone, there are 3-4 mother tinctures which are very, very important, commonly used. Then I will say what I use sometimes. First, you must think about Berberis vulgaris. Second, you must think about Caradus marinus. Third, think about Chionanthus. Fourth, think about Chilodonium also. Very, very good results in your practice. But with Mata tincture, I have had good results with few remedies. You must write down. First is Phil Tauri. Phil, Feeltauri. Phil Tauri first. Second, Cholesterinum. Cholesterinum in 3x potency or 6x potency will give you good results. In LM potency, I had a case, where I had prescribed the patient DNA 0/3 once in 3 days, and that has given me good results. Of course, I gave that DNA LM potency as an intercurrent remedy because there was a family history of gallstone in that what you call family, and that patient had wonderful result with DNA. The gallstones were cured. I have the report also. So this is how you have to evolve in your practice. Every time the same protocol may not follow, just as the patient, just as the history, as I was telling, case taking is a very integral part of homeopathy. It is very important, and it is very important because that gives you an idea about the family history, the past history, the present history, and the will of the patient. We'll be doing, if everything goes well, we'll be having some international doctors, attending my live offline session if everything goes well. In that, I will be describing that how case taking is important and whatever are my views about case taking, what I look in that patient, with some beautiful results in case taking. If that happens, it will be nice because offline sessions have started and we are doing offline sessions for doctors in Nagpur and all, and they are very interesting. So case taking is very important. The simple case taking, if done very precisely, it gives us very good results with most of the polycrest remedies. I hope, doctor, you understood something about gallstone, and if you do understand, no thumbs up, there's a lot of thrill when you get thumbs up and hearts. You feel that you are doing something very good for yourself also and for the doctors also. But I think the crowd today is very, what you call, dull. No enthusiasm. Let us have some enthusiasm. So it also creates enthusiasm in the speaker also, and you can get some beautiful answers and good answers which you have never thought of. So keep sending me some thumbs up and hearts 100% as now we are getting. It really gives a very boost. It gives an adrenaline rush, and when you have an adrenaline rush, automatically the symptoms starts coming. For example, in iodine I told you irritability better by eating, sadness better by eating. That eating part is important. Physical activity better by doing physical exercise. One symptom also iodine, I just remember, I have given a lot of hearts and lot of 100%. अभी हम दिखाता आपको in iodine. One symptom is very, very important. Persistent thought of homicide. Persistent thought of homicide, that is iodine. Very, very important symptom of iodine. Persistent thought of homicide. One symptom of iodine, do write in your mathematica. Weeping when spoken kindly in children's. My dear friends, weeping when spoken kindly in children's. The patient says, when I talk very kindly to my children, they start weeping. But that is admonition. There's not admonition. So don't confuse that with admonition. Very kindly talking to your children, the child starts crying. Think of iodine, think of silicia, and think of thuja. Very, very interesting. That is iodine. That is the integral knowledge. Where can I find the thumb? Dr. Babel, that I don't know, because you can find sometimes in your when you're offline. Just check out and just give. You can give something else also. Eucalyptus stomach. Okay. Oh, sorry. Some of the questions have scrolled up. Sir, प्रॉपर ऑटिज्म एंड सीपी चाइल्ड पे वीडियो बनाए प्लीज़. ओके. अरे ये वीडियो तो मैं बनाऊंगा, लेकिन अभी जो मैं आपसे बात कर रहा था डॉक्टर गणेश की, मैं ऑनलाइन दिखा रहा हूँ. आजकल तो मैं ऑफलाइन में क्या पेशेंट बुलाता हूँ, और फिर पेशेंट ने अगर बोलता ना तो बहुत कॉन्फिडेंस आता है. आज के ज़माने में कॉन्फिडेंस बहुत इंपॉर्टेंट है कि हाँ पेशेंट ठीक हुआ है, और हमारे पास फॉलोअप कम से कम 2-3 साल का चाहिए ना, तो मज़ा आता है. तो कभी कभी क्या ऑटिज्म के अंदर सीपी केस के अंदर जैसे इग्लू, कभी अब ठीक रहता है, कभी बच्चा खेलता है, तो हमने अगर शूटिंग कर ली ठीक होने के फेज में और दिखा दे ठीक होना, कभी कभी लगता है सही में ठीक हुआ कि नहीं. जब ऑफलाइन हम लेते ना और पेशेंट दिखाते ना, थोड़ा मज़ा आता है. बट आई विल डेफिनेटली पोस्ट माय वीडियोज ऑन दैट. इफ स्टोन स्टक इन बाइल डक्ट, डॉक्टर यासी, अगर बाइल डक्ट में स्टोन स्टक हो गया तो बहुत प्रॉब्लमेटिक है, बिकॉज इट इज़ वेरी पेनफुल कंडीशन, यू नो. एंड इफ दिस इज द केस, write down the remedy. I have used this a case of gallbladder, and the patient feel that it's stuck in the bile duct. Two remedies are very very important. You have to start belladonna LM potency. I have got the best results when I have used belladonna LM5. Every 15 minutes repetition in 1 hour, the patient is better. If you don't have LN potency, I have always given Colosin mother tincture, and it has worked. It has worked fantastically. If it is not there, you can use Colosin 30 potency repetition or in water dose, which has given me very good results. Okay, so these are the two things which you must remember. There were some questions on WhatsApp. Dr. Prashant Verma, welcome. Dr. Parvinder, welcome. Welcome, but you have all joined late. You know, we are just already 30 minutes have up. Eucalyptus stomach, Dr. Yasir, maybe I'll discuss tomorrow because on the next YouTube or Instagram live. And we have already half an hour up. So everybody, I hope you like this video, and thank you for joining me. And I hope you enjoyed hearing me as much as I enjoyed teaching you. So thank you, and thank you for now.